Hi everyone, Dr. Witt here, your local mobile chiropractor here in Alameda in Oakland. And I'm here today to talk with you a little bit about the sciatic nerve and what is commonly referred to sciatica, which is irritation of that sciatic nerve. So the sciatic nerve is actually made up of a few different what we call spinal nerves, which are these guys right here. They come out of the areas between the vertebrae, which are these guys here. So they come out like this. The sciatic nerves comes from these levels here. They come together and then they travel through the pelvis and they come out here and they go down the leg. So the sciatic nerve can become compressed or irritated in a few different places. The most common way that it becomes compressed and irritated is when these right here, these are the intervertebral discs, they can become bulging or they can actually herniate, kind of like this one right here. And you can see it's putting a little bit of pressure on that nerve. So when that happens, we get irritation of that nerve, and the common symptom for sciatica or nerve irritation of the sciatic nerve irritation is going to be pain, tingling, or numbness that goes down the leg, sometimes to the front, but most commonly it's going to go down the back, past the knee, into the calf, and to the heel. So that's the most kind of textbook common way that people experience sciatica. So, like I said, the most common way is because of those disc issues in the low back, super common, especially with our desk workers here in the Bay Area, your programmers, IT, salespeople, all of that. The second way that the sciatic nerve can become irritated doesn't have to do with the disc, it actually has to do with a muscle called the piriformis muscle. So the piriformis muscle attaches here and it comes down and attaches to the femur, which is that thigh bone there. So what happens there is, right, the sciatic nerve is coming out of that notch, so it's going down, it goes under that muscle. So with people who sit a lot, right, they may actually end up getting some tightness in that muscle, which then compresses that nerve and causes that pain, tingling, numbness down the leg. The third way, and this is actually a really interesting one, is from irritation of this joint right here. So this is called the sacroiliac joint. This is the ilium, this is the sacrum, this is the joint between them. So when these joints get irritated, again, very common in especially our seated workers, then because that nerve is coming out right here, irritation in this area can kind of leach over a little bit onto that nerve and cause that irritation of that nerve. So it's really common, especially like I said, for desk workers. And the way that we like to treat that is by giving people, one, we do manual adjusting of them, so we do some chiropractic adjusting, and then we're also going to give them some exercises and stretches to help to deal with any tightness that might be developing or has developed in that area, just to get movement back into those discs, because movement in the discs are how they stay healthy. And we're also going to recommend sometimes some supplementation of some anti-inflammatory, such as turmeric or omega-3 fish oils, for example, as well as just generally encouraging movement overall. So I like to have my patients walk maybe 15 to 20 minutes per day, just around the block as much as they can. And after a few appointments, usually within about 2 to 4 weeks, we see some really, really great results with patients who have some sciatica issues, even if they've had them for a really long time. So if you've been having any issues with your sciatic nerve, some pain going into the front of the leg, down the back of the leg to the heel, for example, then go ahead and give me a call at 510-671-1716, or you can go ahead to my profile and you can click on my website and get some more information there on how to schedule with me. And let's work out a plan so that we can get you up and moving and get you back to the life that you're loving, okay? So it's always great talking with you guys, and I'll see you again next time. Have a great day.